Hello everyone, welcome to another informative session with us at Meta Clinic Nigeria. I'm talking to you today about vomiting and diarrhea in children. Yep. So let me just tell you this. Children die more from diarrhea and vomiting than from malaria, tuberculosis, all of those big diseases that we may think are the major causes of death in children. Now, we can prevent this, we can stop these deaths with using just the simple ORS that is easy to get and we can easily keep at home. So what will usually cause diarrhea and vomiting in children? You would agree with me that top on the causes, particularly for children who are teething, is a matter of hygiene. Their toys, the table edges, the stools, their food preparation, feeding bottles, spoon, and all of that. And even, the food mix, the food preparation itself. This usually stands out to be a major cause. And other things that could cause diarrhea and vomiting, even use of antibiotics from some other disease will take away some protective organisms in the intestines of our children and then cause vomiting. Also, when we travel to other areas that there may be bugs, that are heavily present there, bad water and all that, so still going back to our hygiene. And just some form of other diseases too. So it can be that maybe the child even is showing signs and symptoms of diabetes. Yes, some small children have diabetes. So this can be causes of diarrhea and vomiting in children. And of course, when we talk about what signs and symptoms will be shown, diarrhea and vomiting. So by diarrhea, we mean passing loose stools persistently, so watery, or in some cases, they may even have blood and all of that. Then they're vomiting, they keep on vomiting. It's not just okay because they are overfed or something. You notice that, this is unusual. This should ring an alarm system in you to do something about it before it gets out of hand. Now, sometimes there may be fever, there may be abdominal pain alongside, and then the danger signs that I really want us to look out for always when children are having diarrhea and vomiting would include when we start seeing their eyes going in, getting something. That is a very great deal. When you notice that their urine output is becoming low, a child that will usually pee 3, 4 times daily is now peeing just once. It's a big deal. Or you notice that their lips are so dry, or they are trying to cry and there are no tears. These are alarm systems, that things that would make you quickly do something about it because it's a danger zone already, and death may even occur in no time. Now, why all of this happens is because they are losing all of the water in their body, and children need water in their body at all times. Their body is actually made up of a lot of water, and the survival of the whole body system depends on this water. So once you have this, you need to rush to the hospital. But before even rushing to the hospital, that's why ORS I mentioned earlier is very important. You start it. Directions, for how to make it are behind. Usually a sachet to about a liter, and then even if you don't have a container that's a liter, there are different home bottles that you can check up on how are close to a liter, that you can easily mix this ORS and start giving the child before you are even attended to in the hospital, so that it keeps on replacing the fluids that they are losing. But the cause of that problem has to be found, and that's why you need to go to the hospital, because these ORS that you're giving will not stop the cause, but it's only helping to replace, so that the child does not deteriorate and get worse. And of course, in the hospital, the doctor will quickly assess, sometimes even pass a tube through their nose to give them more water, or put cannulas, the flexible tubes on their hands, so that they rehydrate them quickly and properly. And you know we must try to prevent this vomiting and diarrhea in children by being very, very meticulous with their food preparation. Our hygiene has to be top notch. Yes, we must even tend to move towards cup and spoon feeding rather than feeding bottles, because they are easily, you know, cleaned rather than bottles, because of the crevices and all of that where bugs can hide. And then you have to supervise whether maybe where your child feeds, and then even method of storage of these foods are very, very important. Also, there are vaccines out there. You see, there are vaccines that help to prevent, that help to prevent bugs that easily cause diarrhea and vomiting in children. So adhering to our immunization schedule is very, very important. And then this education that we have, so that if it happens, we know what to do. So please, let's not play with our very, very dear ORS that we have all around. Sometimes as free programs is distributed, you can have it in stock, at home from the nearby pharmacy, and always, renew your stock when the expiry date run out in case you never use them. So thank you for watching this video. Please let's do well to ensure the safety of our children.